What's up? It's Master Hogan, helping you master yourself. Today we're talking about the piriformis muscle. We're going to look at its anatomy, its functions, all of them, and then we're going to figure out if it is a cause of your low back pain. I'm going to show you how to do that, and then we're going to explore what to do if it is. So, firstly, let's talk about the anatomy of it. We saw yesterday that it attaches at your femur and at your sacrum, which is kind of like a lower part of your spine, but is around the hip area, around your butt. So let's locate it first. First, to do this, let's stick your hip out to the side, like you're sticking your butt out, and then find your hip crest. From there, with the hip stuck out, go directly down. The most bony part right there is the greater trochanter of your femur. That is where it attaches at one point, and then right above your butt crack area is the sacrum where it attaches again. So if you connect those lines, that is the sort of path that the muscle follows where it attaches, okay? From there, we're going to talk about its functions. And this muscle is a little bit weird, and that is because it does two opposite movements, which is really pretty weird. So normally when you're just standing, like in an anatomical position, it externally rotates your leg like this. Externally rotates. And you have one on each side of your body, of course. But it also internally rotates your leg, and you might be wondering how could that be the case? Shouldn't it do one or the other? Yeah, it should. But the thing is here, it is sort of put in a different anatomical position when you flex your hip, which is what this looks like right now. This sort of hip flexion here. So it has the job of internally rotating your leg when your hip is in flexion versus when it is neutral or extended. Okay, so a little funky thing there. On top of that, it also holds the femur in its ball and socket joint. So there's like a head of the femur, and then there's a sort of thing like this in your hip, and the head of the femur fits in there, and it's supposed to be pretty tight in, and when the part of the piriformis attaches to the greater trochanter of the femur, it kind of holds it in. So it needs to be strong enough to do that, but it needs to not be so strong that it causes dysfunction, which leads me to the next thing. The dysfunction here that we're talking about that typically happens is sciatica, because your sciatic nerve runs underneath it. So if it is too flared up or something of that sort, when you contract it, it can press on the sciatic nerve, and that will cause all kinds of weird pain. People with sciatica typically present with like numbness or tingling, sometimes burning from, could be like your low back all the way down to your leg. It depends where it's originating from. And for that reason, we're exploring this to try to figure out whether this is a cause from your piriformis that is dysfunctional, or if it's something else. Usually it's like a bulging disc or something when you're in between two of your vertebrae. So how do you differentiate? Well, find yourself a surface first. This is going to be the easiest way to figure it out. We're just going to take your leg through its ranges of motion that target this muscle. So find yourself a surface. The first thing that we're going to do is just lay down, and then we're going to move in and out of internal and external rotation, and then do that while moving in and out of hip flexion. So pretty easy. I'm going to internally and externally rotate, and take note here how it feels. So you're looking for flare-ups of pain. If you have it, then that's a pretty strong indication that if it's performing the action that it should be, depending on what position it's in. So if your hip is extended like this, and you externally rotate and you have pain, then that would be like a positive test. If you internally rotate and then you move up into hip flexion and you're starting to feel the pain, and if you especially have those two things together, then you know that's really a positive test for that. So then I would advise do it on the other side. If you don't have it, then you can be pretty sure that it is probably the piriformis, because if it wasn't, if it was like a bulging disc or something, it would be more likely, not necessarily always the case, but it would be more likely that it would happen on both sides. So that's how you differentiate. Now what do you do about it? So again, we got to revisit the functions. So the easiest way is going to be to stretch it out, but we don't want to crank it out because this is a little bit different than normal muscles. Typically muscles don't have big nerves around them the same way that the piriformis has the sciatic nerve. So you got to be a little bit more careful with this so that you don't just make it worse. And for that reason, I also would not recommend starting with foam rolling or a tennis ball or a lacrosse ball or something, because you don't want to just sit on it and make it worse. So for our stretch here, the best way is to get into a figure 4 position. So once you've essentially diagnosed that it is your piriformis that is dysfunctional, do the side that, perform this on the side that is having the dysfunction. So if it's my right side, then I'm going to make this figure 4 position here, okay? You don't want, again, you don't want to just crank out like crazy ranges that are going to add to this dysfunction. So you don't want to just go here or just do one of these. We're going to ease our way into it a little bit more. So if this is my side that is in the dysfunction, then we're going to come here and then put your other leg behind you, sort of as like a brace almost, just for balance. And then you're going to have your hands here to balance. And the reason we're doing it so like gingerly like that is because you don't want all of the weight on that muscle stretched out. You want to be able to control how much stretch you're putting through that muscle as much as you can. So we know that when we're in hip flexion, the function of this is to internally rotate. So to extend it most, we're going to externally rotate, which is why you see here my leg is externally rotated. And then we want to move into that range as much as we can. So instead of bending forward over, we're going to bend kind of to the side. And if you recall, whenever we're forward bending at all, you want to keep your chest and torso up straight and bend at the hip as much as you can to more strategically target that stretch. So when you're doing this, you will definitely feel it here. And again, just keep the hands down so that you're really helping out and making sure that you're not stretching as much as, not cranking it, not stretching as much as you possibly can. Just doing it gently, easing into it. So I would recommend doing this for like 90 seconds to 2 minutes-ish, maybe a few times, and then do it multiple times throughout the day. And of course, this is all if this is your dysfunction. So if you find out that this is not the case, like if all signs are pointing to a bulging disc or something else and you're not sure what it is, this can't hurt, but it is not necessarily going to be the exact target to the problem. So just something to think about. Along with this, you could have a partner, or you could do self-massage. You could either one is going to help the quality of the tissue in between, because stretching will kind of address the whole tissue, but it will, especially if your muscle is dysfunctional, then it will just pull on the ends more so than it will just super stretch out the whole tissue. So you still need to address the quality of all of the tissue in between the ends. So to give that some love, literally give it some love, have some self-massage or the partner massage, and then just use that how we located it previously. So you just find your hip, and then you'll find that part above your butt crack, and then just move and massage along the line of where you know that it has its attachment sites. Okay, so kind of a lot, but all of that is kind of just a way to target, diagnose, and make sure that it is not something else. So again, we're just ruling out that the pain is originating from a point in your back, and then if we're finding out that it is the piriformis here, then we're addressing it as such. Okay? I'm Master Hogan, helping you master yourself. Take care. I'll see you in the next video.